Thanks for staying with us. A coalition of health associations is proposing an alternative to national health insurance. Universal Healthcare Access Coalition says its plan can be implemented more rapidly and cheaper. It proposes a dual system with free services for the poor and mandatory insurance for the more wealthy. The group says this plan can be rolled out within 3 to 5 years, while NHI would need over a decade. The SA Medical Association is part of that coalition. We're joined by its chairperson, Mvuyisi Mzukwa, who joins us virtually this morning from Durban, I believe. Mvuyisi, thank you so much for your time, as always. Explain to us who makes up this coalition.
Good morning to you and to your viewers, and thanks for inviting me. Well, the Universal Health Access Coalition is made up of different groupings in the healthcare sector. The South African Medical Association, the SAPAF, that is the private specialist organization, and also PHF, which is Progressive Health Forum, and other entities that are signatories, significant entities that are signatories to this Universal Health Access Coalition.
Now, your coalition has described the plans for NHI as it stands as, quote, fiscally and institutionally unimplementable. Those are very, very strong words, and we've walked a very long road now to get to this point where we are at with NHI. There are legal issues involved now as well, but those are very, very strong words. How strongly do you feel about that?
Thank you so much. First of all, I think we need to stress the fact that we don't consider this as an alternative to the NHI, because if you look at the NHI, it's just limited to the funding, or it's a funding model of the healthcare system. This goes broader than, the NHI, because it talks about systemic reforms that were proposed in that document. You will recall that, for more than 20 years now, there have not been any healthcare reform, and we're waiting for this NHI, and everybody is folding their arms, not doing anything, waiting for the NHI. But if you look at it now, there are many issues that are identified which are problematic when it comes to the NHI. First of all is the issue of funding of the NHI. The funding of NHI is solely based on taxation. And we're saying it is highly impossible that you could rely on taxation because of a very small tax base in South Africa. We are saying you are leaving other high-earning individuals scot-free because now they'll be everybody will be dependent on this taxation. So we are saying that is impossible. It's not sustainable at all. People can try their best. It's not sustainable. And secondly, we've reached a ceiling when it comes to taxation. We can't go up anymore. Otherwise, we'll see people not complying with taxation. That's the first thing. The second thing is the issue of the fact that, NHI is centralizing healthcare and shifting away functions from the provinces to the national government. National government has never run any hospital. All hospitals are run by provinces, and we're saying leave the provincial structure as it is. But what you need to do is to make sure that you make institutions autonomous, but also you attach responsibility by making sure that there are supervisory boards that are in the hospital, not the advisory, but supervisory boards that are going to hold accountable the CEOs, but also that autonomy can allow them to make decisions, but to be innovative. And they can, when they are innovative, they can compete with the private sector, equally. And we're saying that if you do that, you will allow, even medical aids patients to see doctors access those services in the state.
Now, the new framework that you have put on the table obviously focuses on the need to improve governance in the public system. But another thing that I think is quite noteworthy is the need that you say there is for the regulation of the private system. Because you're sitting with a situation where many people who have taken out medical aid feel that they're doing so because they have no other choice But we keep hearing reports of sky-high rates being charged by doctors, according to medical aid. Medication costing a certain amount when somebody's paying cash, and then that number being almost doubled when they're paying with medical aid. Speak to me about the specifics of how you see the regulation of the private system under this new framework.
You know, our proposal is based, including the report of the health market inquiry. And the health market inquiry makes it clear on how, the private sector should be regulated. Because like you said, everything that you've said now is so true. Private healthcare is expensive because it's unregulated. And the health market inquiry has made it clear. And the recommendations are there for government to regulate, the private sector. So all we need to do is to go back to those recommendations and make sure that, even the price negotiations and everything else that is there should be brought, on board so that we can regulate the private sector. So there are many issues that can be done around the recommendations themselves. The minister has been promising that he will have a media conference on how to put up on how to implement the recommendations. But we have not seen that as yet. So it's not only us focusing on the public sector, but we are saying even the private sector. In fact, we want the private sector to be regulated because we can't go on like this. Otherwise, it will collapse if it goes the way it's going now.
Do you get the sense that there is still room for discussions, for looks at alternative models in this space, especially in your interactions with government?
Well, we were invited by the president to say we must come up with proposals. We have brought up the proposal as the healthcare profession. So we expect that government would consider. We don't necessarily think forcing them to agree, but at least they must, look at it logically. They must make sense of it, and it must be discussed by all South Africans because we think this is pragmatic. It will give, access to affordable, quality, and a healthcare system in the country. And I think it's scalable as well. It's adaptable and scalable. So people should look at it, interact with it, question it, but we don't think that NHI on its own is going to take us there. It is not going to take us there.
Okay, the SA Medical Association Chairperson Mvuyisi Mzukwa joining us virtually this morning. Thank you for your time, as always. From the world of medical matters to road cycling, Nicole is up next.